reviewing ClinicalKey and talk about various aspects of it that can help you either as a librarian or as a nursing faculty and even a nursing student. My name is Selah Sherling, and I am a customer engagement analyst here at Elsevier. And my love and my longest career is that I'm a librarian. And I was a librarian in higher education institutions and an Elsevier customer, and then switched over and now work for them. So I'm excited to have 14 nursing students in a room watching this presentation. I've done hundreds of those over my career, so I'm glad to have y'all on this call. So let's go ahead and talk about the product and how to get to it. So as Jeremy mentioned, it is on the Howard University library site. So when you're on campus and or even maybe you use VPN or you get to your login to the campus from offsite, you would simply go to the library webpage. You would find the word ClinicalKey, which is probably on the database list, and we'll review that at the end of the session, and simply click on ClinicalKey. Now, once you've done that and you are actually authenticated and you're actually in the product, and I'm not talking about being on your personal computer at home and just Googling ClinicalKey and then clicking on it. You need to be actually accessing the product through a valid method. One way you can tell if you've done that, type in something like sutures, and you should get 24,000, give or take a few results, okay? If you're not getting that and actually able to click on something and see content, then you've not really accessed the product through an authenticated method. So again, it's going to be on that Howard University site, and you'll find it. And if you want me to, I'll just throw that. Let's see, he put it in here. You read my mind, Jeremy. So here's the Howard University Library website. If you click on databases, you're going to see ClinicalKey. It's under this A to Z databases, and C will of course take you to ClinicalKey. You can see that it's popular. It's also being listed over here on the right. Okay, so that's the way you can get to it. And then once you're there, I would recommend that all of you, especially you 14 nurses, go ahead and register for the product. You're going to do your first name, your last name, the email address associated with Howard, and then a password that you create. It can be whatever you like. It can be what you normally use to log into the university or whatever, but you are creating a personal account with ClinicalKey. You will need to check the second box at least. You do not have to check the first one, but you do have to check the second, and it's just the registered user agreement, and then simply register. Once you've done that, there's 2 more steps to get remote access. Now you'll log in, use that login that you just set up, and you'll know you're logged in because your name will appear on the right. I'm on a demonstration account, so I'm getting a list of choices. You're not going to get that same list, but you'll know you're logged in when your name appears here. Now, go ahead and click on your name and choose Remote Access. You will put in your email address, the one you used just a few minutes ago when you created that personalized account. Not Gmail, not Yahoo, not some other website, web email address that you have, but the one affiliated with Howard, because that's the way we've configured the account. Then hit continue. You will then receive an email in your Howard email inbox. You'll click on that. It'll be from Elsevier. There will be a link to activate that remote access. Then from that point on, you'll have 2 choices to use the product. On your phone, you can open up a browser and just go to clinicalkey.com and log in, and you'll have the full web page like you see here. Or you can go to your app store and you can find ClinicalKey. Now, don't get confused and get ClinicalKey for nursing, because you may think, I'm a nurse, I need the nursing one. Howard purchased the one called ClinicalKey. And there's great content in here for nurses, and we'll go over that today. So you're going to download the app just like you normally would, and you'll be able to, you've got to choose that it's ClinicalKey Global. That's the one y'all have. Make sure you choose this first dot, and then you're going to, this is where it gets a little confusing. Access via your institution. You're going to put in your email that you just used to register with, and then it should just walk you through this next step asking you for that password. And that password is going to be the one that you just created. So we'll go over that. Maybe Jeremy can be the contact if anyone's having any struggles. And then if he needs to reach out to me over the next few days, I'm always happy to get on a team or Zooms meeting and walk through with anybody. But it works pretty straightforward, provided you first created this account, because otherwise it doesn't know you're supposed to have access to the product. So nurses, you'll be able to either use the website on your phone or on an iPad, and you will also be able to download that app and use that. But first, you've got to personalize. And Mary, are they in the
All right.
library or are
Can
they
you,
on
I'm
campus?
sorry. We had somebody burst in the room. I got distracted the last couple things you said. Could you just say that again?
Yeah, I just want to know if the person that burst in is okay.
Yeah, they thought they were in this room. That's all.
Well, I want to know, are y'all physically in the library right now or
We
physically
are.
on the excellent?
Yes.
So I would get all of them to do the, you know, go to Howard, the website here, they're logged into the library, databases, C for ClinicalKey, click on that. Then when they get in here, then they need to register and then log in. Then they'll go to remote access, set that up. And my point was, once they've done that, it's very easy to get to the app, or
If it
they
would
can.
be helpful, I'm just jumping in real quick. This is Jeremy.
Mhm.
Pamela Thomas Roots, who is also on the call, she is our nursing librarian. Pamela and I can come by that room after this presentation and make sure everybody's set up okay, if that would be helpful.
That would be very helpful. We're in room 138.
Sounds
Thanks.
good. We'll see you then in just a little bit.
Thank you.
Thanks, everyone. And Mary, what I was saying, if there's any trouble, just go through Jeremy, and if people are having trouble, we'll get them set up and configured in the next few days. And he's going to come over this afternoon and help as well. So that's terrific. So that's the way you get access to the product. So what in the world is in the product and why would you want to use it? The product is vast, and I tell people that it is basically like a virtual library curated for the physician. And I often say physician because it is called ClinicalKey. However, our sister product, ClinicalKey for Nursing, there's very similar content and there's some duplicate content in there. So I'm getting ready to tell you about 4 content types that are in this product. They're also in ClinicalKey for Nursing, so we don't need to be worried about not being in ClinicalKey for Nursing. This ClinicalKey has the same point of care content in it. So let's pretend that you are with the patient, you've looked at the chart, and they have cellulitis, and they're in the hospital because of this particular infection in their arm or leg, and you've not dealt with that before, and you just need a little bit of information about it. The product content that I would recommend are the clinical overviews. And when I said this product is vast, let me show you what I mean by this. If I just search all types of content, I found over 16,000 articles. That's a lot to digest, especially if you're at that point of care situation. And so I like to teach the different content types that are in the product and what information need that content type will meet. Because as you can see, we found an article about cellulitis and infectious disease clinics of North America. We found books, images, clinical trials, the clinical overview, videos, guidelines, drug monographs, something called a procedure video, patient education, a calculator, actually 3 calculators, and something about a drug class overview. So this can be overwhelming, especially at that point of care. So if you know you're in that situation I described, you need to know a little bit of information about a situation you're in with a patient. I would just specify make it only find clinical overviews. So we'll pretend we're still working with the cellulitis situation, and now we're going to have much more precise results. Only 87 results. Every one of them is a clinical overview. They are the only content in the product that has these brightly colored pills. And these pills are designed, again, to save you time. Maybe the situation is where they've been in treatment, they've been in the hospital a couple of days, and you don't want to read all of this for some reason. You just need something quick because look, there's a lot in here. You could simply click on the pill that says treatment, and it takes you directly to that content item in the product. So it's highlighted this little blue bar. We're in the treatment options. We have drug therapy, non-drug and supportive, comorbidities, and special populations. So that's what those pills are for. They're designed to bring you into a specific part of the product, specific part of the content that's going to save you a little bit of time. Now, you may also wonder, well, why did it bring up septic bursitis when I typed in cellulitis? And why did it bring up necrotizing soft tissue infections? Because the search is a relational search. Most of you are probably familiar as nurses of using CINAHL, the Cumulative Index to Nursing and Allied Health, or some other bibliographic nursing database where you use ands and ors and nots and parentheses, and you maybe type out a lot of words here. This product is not like that. I would be simple before I would be complicated, and you're going to have better searches that way. So it picked up septic bursitis and this because it is related to cellulitis. If we go ahead and open up the full clinical overview, we can see a little bit about it. All of y'all know what a journal article is. You know what peer-reviewed means. You know what an academic journal is versus a trade magazine or things like that. You've heard peer-reviewed and scholarly article probably for the last 4 years of your lives. So what in the world is a clinical overview? How do you know it's reputable and trustworthy? This little link that I clicked on, see the details about Elsevier point of care, tells you about it. They're written by subject matter experts. They work with a team of clinicians and editors at Elsevier. What are they? They're concise, easily scannable synoptic documents. They've got evidence-based information, current guidelines, and the latest advances in clinical practice. I'm not going to read all of this, but you get the idea of what this content item is, why you might need to use it, who creates them, are they evidence-based, when are they updated, and a little bit about our current editorial board for the clinical overviews. So they are trustworthy. On the left, you're going to get a synopsis, key points, pitfalls, any terminology you need to know, the diagnosis. You've got images on the right. So you've got history, the clinical presentation, as well as the physical examination that one would do, causes and risk factors, the diagnostic procedures, any laboratory work that's done. If there were, it would be listed. Differential diagnosis, most common situations, treatment, the goals, the disposition, admissions criteria, options, monitoring, complications, screening, etc., etc. And at the very bottom, we are going to list our references. So these references they were used to either develop the clinical overview or they were cited somewhere in the clinical overview. The view an article will just pop me back up to where that very first reference was listed in the key points, and toggling here, if I click on this one, I get the nice citation as well. So if you have an assignment where for whatever reason you had to write on cellulitis, starting with the clinical overview will be useful because you can get that nice summary content to get a background and a good understanding of the situation. And then you've already got a great list of references put together for you that you could then go forth and find them either in the library or in some cases within the product. Here's your journal citation there. You also have an option to save this content. The little stars will allow you, with a personalized account, to create your own little bookshelf within the product. I've already saved this one a couple of times, given it some cellulitis example, cellulitis. Let's add a new one. We'll call it One Howard, just so I can remember to find it easier, and done. So where did that go? How do I find it the next time I log into the product? Go to your name, go to saved content, and all of your saved content will be here. And I have way too much, as you can see, but here's my One Howard, and it would take me directly to that clinical overview should I need it. I can even add notes to this. Maybe I need to say, study this for exam next week, October 20th. Whatever I want to say, up to 140 words. So now this little note is in my saved content. No one else can see it in the product. It's great for nursing faculty and educators. Maybe you're building out a syllabus for next summer. You could start saving things for summer 2024. Whatever it is that you want to say in there, it's all up to you and available to you. Now, that was one of the content items that I think of for point of care. The next one is the patient education. So you've got that patient, they have cellulitis, someone's in the room, maybe it's a caregiver, and they want some information or they're asking you a lot of questions about it. Simply choosing the patient education information is going to make that very precise search. We found 18 pediatric cellulitis, a couple of adult cellulitis ones. It listed in here a few times. It has everything that one might want to know. What are the causes, the risk, how's it diagnosed, what are the instructions I follow at home, get help right away if, and then a nice summary. Again, if this is the type of patient you see often, save it. Then you don't have to search it next time. It's always under your saved content because everybody has specialties. You may have certain things that you're visiting over and over. The top of the page will take me back, and let's look at this. Now, y'all are in Washington, D.C. I would think that you have many, many languages that are spoken there in Washington. So you have an option in this particular case to print this patient education sheet in all of these languages. I tend to like to look at Vietnamese because I like to see what it looks like on the screen. You do have to create a printable PDF before you see it. And once you do that, you would print from there. So I'm saving it. And then here's my patient education sheet about cellulitis. Starts out in English, but then the actual page is in Vietnamese. Most of those patient education sheets are in at least English and Spanish, but this is a great example of all of the different languages that might appear depending on the particular patient education sheet. Now, we've looked at 2 point of care content items. We found those here. I knew I wanted a summary content, so I clicked on clinical overview. I knew I wanted patient education, so I clicked on patient education. What in the world are these boxes in the middle of the screen? These boxes allow you to browse. So back in the day, maybe when books, maybe in certain areas were in alphabetical order, you might go up to a shelf and browse them in alphabetical order. That's what this allows you to do. It's just an alphabetical list of all the patient education sheets that are in the product. If I want to, I can search by title. What will I find? I'll find what we were just looking at. So here's all the cellulitis ones. Tip that you need to be aware of. If the word is not in the title, it's not going to find it because the browse is just looking at the words in the title. This search at the very beginning looks for it anywhere. And that may be a simple concept, but sometimes people get confused by that. This is a keyword search, whether or not it's in the title or not. The browsing is going to only show you those key titles, so everything that has the word hard in it. So that's what that is. So keyword in the title with browsing. Now, while we're here, I do like to show you this. Over on the left, you can limit by specialty. So nursing faculty, if you were teaching an entire session, maybe not even a session, maybe you have a whole class on neonatal and perinatal. There's 262 patient education sheets. You could simply limit by that and have all of those quickly available to you. You also can look and see how many languages are in here, and the numbers to the right indicate those patient education sheets. The Spanish is a big one. Over 11,000 patient ed sheets are in the product in that language. The smallest appears to be Ukrainian with 175 patient ed sheets in Ukrainian. Clicking on ClinicalKey or the Elsevier logo on the top left will always take you back to that home page. Now, let's talk about the next point of care item, and that is the drug monograph. Let's pretend that, well, let's go back to that clinical overview and let's get that cellulitis. Now, I might need someone in the audience to remember because I'm not typing this in or taking notes rather. Let's see what the treatments are. Cephalexin, okay, clindamycin. We're going to use clindamycin as our example, okay? So that same patient is in the hospital, you're taking care of them, they're on clindamycin. Someone says, you know, I think they're getting drowsy. Is that a side effect, clindamycin? They want to know. You're going to use the drug monograph, type in clindamycin, and let's find out what the situation is. So it pulls up a content type called drug monograph. And we have our indications and dosages. First of all, let's determine that indeed clindamycin is used to treat cellulitis. There it is, right there. Cellulitis is listed as for the treatment of skin and skin structure infections, quite a few, including cellulitis. You've got the oral dosages for adults. You've got dosages for children, even neonates. So this is definitely used by for the indication of cellulitis. You can look at the description, tells you what it's for. We already looked at the indications and dosages. You can look at any contraindications and precautions. In this case, we've got something relating to colitis, and it's actually a black box warning. Well, let's see what that's all about. Well, it's telling us that clindamycin has been associated with severe colitis. So it's one of those black box warnings that you need to know about. It talks about pregnancy and lactations, any interactions between clindamycin and these other medicines. You would then click on that, going to tell you what that interaction is. We also have adverse reactions. So yes, you know, this person is, what did we say, drowsy? I don't remember our example, but we could say that they were having a little bit of a fever. So that is an adverse reaction to this particular medicine. It tells you how it's administered, the mechanism of action, pharmacokinetics. I know that Krishna was asking about that, and we were going to address that for another question for him later. There are also monitoring parameters, classifications, which are the drug classifications, and even the global drug names. Let's say a person came in from China and they said they were on this drug. Well, this drug is clindamycin. We also list the references at the bottom. Notice it's a very high number, 5212. Why is it not number 1? Because we pull this from another drug database that we have, and we have just a huge list of all of our references. So the numbers are very high. Again, you can click on this, and it's telling you the journal in which that came from with the citation information. I'm going kind of fast because I'm watching the time, and we spent a little time going over access, which is extremely important, but I would encourage you to spend some time playing around in the drug monograph. It's full of rich information, and it can easily be found by specifying drug monograph and typing in your drug here. What if you didn't know the drug? And you go back and you type in drug monograph and you type in cellulitis. Is that going to work for it? It did. It brought up some of the drugs that treat cellulitis. How do we know that it's treating it? Well, we go to our indications, and cellulitis should be listed in here, and there it is. Okay. Now you have a sister product, brother product, etc., called clinical pharmacology. And I would encourage us, if you didn't get to go, believe there's another one next week, and it's taught by one of our employees that is a pharmacist, and she'll go into a lot of depth of what you can do in that product. It contains the drug monograph, but it does a lot of other things too. So we looked at clinical overviews, drug monographs, and patient education. What's another point of care content item in the product? The calculators. I happen to know that there's a calculator in here with this terminology in it, and I want to use that as my example. The venous leg ulcer healing prediction. So this person has cellulitis, perhaps it's become some type of ulcer, and they want to know, when's it going to get well? Well, there's a way. It's called a calculator, but it's not a numerical calculator like we tend to think about. It's allowing us to input information, and it's going to give us an output. So our total criteria point will change as we start answering these two little questions. Is the wound greater than 5 square centimeters? We'll say it is. Have they had it for more than 6 months? Yep. And so their chance of healing in 24 weeks is about 13 to 37%. That tells us here there's actually a little dollar sign. We need to change that to a percent point. We also list our references. So here is a reference to ACPJ Club from 2001, and it's a simple model based on wound size, predicted healing of venous leg ulcers. We also have an article, Which Leg Will Heal with Limb Compression Bandages? And we have the associated ICD-10 codes and also the ICD-9 codes. So we try to show you references that relate to whatever content product that you are viewing. There's a lot of great stuff you could do. If you were assigned a particular calculator to research, I would start with this and see if that calculator is in here. Then you see the calculator, you've got some references, and even the ICD-10 codes that relate to it. Clicking on ClinicalKey, we're back to the main page. And that was 4 different content types. You can be very specific and tell it what kind of content type you want it to be. So, Mary, can the nurses talk to you and then you can talk to me?
Yes.
All righty. So let's ask them some questions. If you need to have a summary about a particular indication you're not familiar with, which content type would you use in the product?
They said clinical overview.
Yay, I wish I had candy to throw at y'all. That's what I would do if I was in person. All righty. And what's the next review? They need to know, what do they do at home? They've been dismissed from the hospital. What kind of content item do you need to give to them?
Patient education, they said.
That's right. And then let's say you're trying to figure out whether or not a person is the severity of the coma they're in. What might you use?
I got a couple answers. One was calculators, and what else did you say? Say it again. Adverse reactions or calculators.
Yeah, the adverse reactions, I mean, that would, if the medicine caused a coma, but let's find the Glasgow coma scale. So good answers, everyone. So here we've got the Glasgow Coma Scale, but it's in a chapter. So it's an article about the Coma Scale. So let's go to the actual calculator. And here we are. And we're just going to fill out our little chart, and then it's going to tell us the situation. Okay. Now, nursing students, you're going to need this. Let's, instead of searching, let's just do a little bit more in the calculators. The dosage calculators are here. So I know I jumped to that quickly, so let me review. Keyword search, browsing search. So if I browse, I can click on body metrics, cardiology, critical care, and all of my calculators are listed here. There's quite a few. If I needed a drug calculator, there's quite a few here. We've got an acetaminophen toxicity assessment, all kinds of different situations. And one that I find to be the most impressive are these emergency resuscitation calculators. If I run this neonatal emergency medication calculator, I can put in my patient name, say their weight, and create that dosing table, and it's like magic. It's created that dosing table for the emergency situations, and there's an option to print it, and there's also a place at the bottom where it's verified by and date. It's not part of the permanent medical record, it says, but must be a reason that would need a signature or something there. So that's one that I find to be extremely impressive. Other ones that you might want relating to drug calculators are let's see, where is it? The unit conversion calculators might be of use to you. So you're going to have all kinds of unit conversion calculators here. If you're doing statistics, those are all under other. So all kinds of things. We've got a pregnancy, when your due date is. And all these statistical ones. So librarians, for the math students at the university, it's quite possible that these statistical calculators, or really anybody doing quantitative research, would be of use. So you might even pop these in some of your other research guides, because quite a lot of statistical use there. So the calculators are fun to browse through, see what they do. You've got your blood pressure percentiles, all kinds of things are there. Okay. So that's a big deal, those 4 point of care content. But what if you need more? And now
So
you're ready.
I found the calculators. They are in clinical calculators. So I found it.
You found what you were looking for. Tell
Yeah.
us, Dr. Kumar, which one is it?
Well, so if you go to clinical calculators,
Mm-hmm.
and then they're all listed. So the one I was looking for was aminoglycosides, vancomycin, digoxin, things like that. So they're all there.
What was it under, so I can show the student?
Okay, so
What do I click on?
yeah, you click on clinical calculators.
I did.
Yeah, and then there is a second one is drug calculators. And then you will have acetaminophen, everything else. The ones I was interested in aminoglycosides. So they have these calculators. And then I'm also, although digitalis wasn't all that I want, but then the important thing is they have one for vancomycin and phenytoin, things like that. Yeah.
Okay, good. All right. For those of you that maybe joined a little bit later, we were talking about this at the beginning of the session, and he had some specific questions. So I'm glad that you found what you were looking for. That's wonderful. So here we are. What else do you need, and what else is in the product? Well, there are journals in the product. So we're going to use my favorite example, cat scratch fever. And let's say that I need some journal articles. But before we get into that, what came up first? The clinical overview. The product is designed, if a clinical overview exists, it's going to come up in your first 1 to 3 results. Okay, so it'll almost always pop up. And so you don't have to specify a clinical overview as long as you know it's going to pop up pretty high in the results list, but I do usually specify that if I know that's the content type I'm looking for. So let's say I need some journal articles about this. Well, there are 1,959 articles in the product, in journal articles about cat scratch fever, and every one of them is full text. Now, this is what throws people off a little bit if they're used to using Cumulative Index to Nursing and Allied Health or Medline or Academic Search Complete or something like that. In those databases, we as librarians usually say, don't limit to full text, because if you do, you might be missing out on something good that we subscribe to through another source. This product is the opposite of that. Everything in this product is full text. So this little default button is going to always appear. So every one of these is full text. I can open it up, I can look at it in PDF, etc. But let's say that for whatever reason, 1,959 articles is not enough information for me, and I need even more journal articles. Now we change the little radial dial to full text and Medline, and now we have those original 1,959 plus about 4,000 more, and every time it says Medline, that's from a Medline citation. We have a relationship with Medline, and they bring this in every night, I think it is when it gets updated. I'm going to show you a specific one. Let's see, cat scratch biofilm. It's just an example I always use because I know it works. So what is in a cat, or rather it does what I want it to do in this particular example I'm trying to show. What is in a cat scratch? Growth of in a biofilm. It's in Medline. Is this full text in the product? No, it is not. But that doesn't mean that you just throw it out the window and don't use it because you're worried it's not full text. You go ahead and click through, and Jeremy, you can tell me, are you guys all set up where your link resolver is working from here? And if not, we'll get that set up for you.
I believe it should be.
Yeah. So on y'all's view, it'll look a little different, and you'll actually see a link that will link you to the Howard journals. But you can also click on PubMed ID. And in this case, I've done this example a lot enough that it's actually free. So don't not use the Medline citations for fear that they're not full text. Go ahead and click on through. Microorganisms is not an Elsevier journal, so we don't have it full text in our product, but that doesn't mean that you can't actually get to it. And so here it is. It happens to be open source and the whole article is here. So I like to show you that you can use the product to not only search for journals within the product, but also to search for journals that are indexed in Medline. Okay. Now, let's look at a couple of other things. So keyword search here, browsing search here. Now, there's a couple of other things available to us. I see a little bit more, actually, you should see all of this. You can use the adverse reactions, the do not crush, the drug identifier, the drug interaction. These are little tools you can use within the product because y'all also have this product. And I would encourage you to play around with that a little bit. Scrolling down, what are the boxes for? Again, they're browsing. But what if we wanted to browse a journal? What journals in here, and I'm going to use our nurse as that example. There are 4 nursing journals in the product, and we'll do Journal for Nurse Practitioners as an example. Let's say that Mary wants to be apprised and aware every time a new issue of this is available. All she has to do is click on this bell, and now every time a new issue is available, which is going to be about once a month, she's going to get an email with saying, hey, the latest edition of Journal for Nurse Practitioners is available, and here are the table of contents with the titles and a couple of sentences that describe the journal articles that are in that latest edition. So subscribing to your content alerts within the product is a great way to stay abreast of various situations. Now, the other thing about browsing the journal is this is the one place that you can just be very specific and make the product only find something in that journal. So I'm looking for the word student in Journal for Nurse Practitioners. Here we have 729 results. using active learning to evaluate student competency beyond clinical skills in the Journal for Nurse Practitioners. Every one of these is in the Journal of Nurse Practitioners. So that can be, if you have a favorite journal that you feel like it's going to have the type of content you're looking for, that's going to be a great way to limit and be very precise. Of course, I could have just done students, year, clinical setting, and I'm going to get a lot more than just from the Journal of Nurse Practitioner, because even though this is ClinicalKey, there's even some information in here that can relate to student nurses and other journal titles. So if you want everything, use the main search box. If you want to be precise and only search one journal, use the browse box. Your books are very easy to use. Same type of concept, alphabetical list, filter by title, Auerbach's Wilderness Medicine, Field Guide to Wilderness Medicine, and you've got all of the content within this particular book. We can search this book. Every article, these 83 are in Auerbach's Wilderness Medicine, and they're all about ticks and tick bites, etc. Again, you can save these chapters. Let's save this one as an example. All right, give me a tag. What do y'all want me to call it? Mary, ask those nursing students what we should tag this as.
What should we tag it at, guys?
It's about ticks, and it's in a wilderness medicine book.
Bloodborne
Ooh, I like it.
parasites.
Blood-borne. Is that right? Blood-borne parasites. All right. Okay. So we're done. We can add as many as we want. We go back up to our name. I'm going to go to my saved content. Now, y'all don't get dizzy as I have to scroll everywhere. I have a lot that I start with the number 1. Here we go. I almost saw it. Bloodborne parasites. And it looks like it's gone, but it's not. It's just way back in the top of my list. So here it is. You can add your notes. Now, we did this on the chapter level. The chapter was titled Tick-Borne Diseases. That's going to take us to that chapter. But what I love about it is that if you need the whole book, it's so easy to get to the whole book over here on the right.
That's nice.
So we went from chapter level saving, but very easy to branch out and see a lot more. Now, while I'm in here, I like this picture of this tick. Guess what? I want to make a presentation about it. I'm going to, instead of saving it, I'm going to add it to a presentation. Let's make a new one. What do y'all want to call it?
Insect or something. Let's see, vectors and disease.
Ooh, that's a good one. Saving it. Okay. Now, if I want to, I can continue building this out and add a lot of things to it, or I can just save a bunch of images and make my presentation later. I'm going to go ahead and add it and view my presentation, and I'll make sure that Jeremy has some brochures about this that he can distribute to y'all. So now I'm still in ClinicalKey, but I've been thrown into Presentation Maker. And one thing I like about the Presentation Maker vectors is obviously not in alphabetical order, but it's the most recent presentation I've been working on, so it's going to come up to the top. Now I can continue to add images if I want to from content that I've saved. Now let's see if I have anything in here about ticks that I might could add from other things. Tick removal. Ooh, tick image. We'll do that one. All right. So let's add this one to the presentation. Which one? The vectors. And this will make sense as you're working on it. So now we've got more added to that presentation. Now I'm still in my saved images. I'm going to pop back into my name, go to that, go to my presentations, and I should have 2 images now. I'm going to export it. I'm going to save it. And it'll pop up with an option to open it. And just like magic, all that information you need for copyright and citing it to make sure that you're on the up and up has all been done for you.
Wow.
Now, you can continue building this out with the Elsevier branded logos, but if you don't like our logo, which is fine, you may want to use your own template. They're in boxes, so they're so easy to just cut and pop them in your own PowerPoint template. And I like that it's a box. The spacing doesn't get messed up or anything. When you cut it, you're just going to be able to paste that easily in something else if you don't want to use our logo. Okay. And you can, of course, make it larger as well. Or I could, go ahead and insert a title slide and finish doing my build. Okay.
Did you say you
Oh,
would have to copy it and paste it and put it in a new presentation to get the clinical key off of there, or can you
you
take
can't
those out?
take them out. See, they're
Okay,
stuck. So
I
if
see.
you want to use a template for Howard or whatever your logo is, just cut them and pop them into your other PowerPoint.
Okay, thank you.
Yeah, but you could open a fresh one. You could, build out your fresh one there. But anything you import out of that is going to have this, and you can't really take them out. But you can easily pop them in another. Did that help answer your question?
Yes, thank you.
Sure. Okay. So now let's go back into ClinicalKey. And we've got just a few minutes. It's 1:53. Let's go ahead and look at some other images. So how in the world did I get in there? Well, remember, we were way down here in a book. We were in Auerbach's Wilderness Medicine. We were reading an article about ticks. And while we were there, we saw an image and we were able to grab it. Now, what is all this stuff over here? This multimedia. The multimedia is the images from the book and the journals in the product. So here's all the images that are in the product, thousands and thousands and thousands of them. You can click and, of course, see it better. You can put it in a presentation, you can save it, you can email it, you can print it, or you say, hey, I really like this article. I wonder what the wording was about. I like this image. View and source is going to take you to the source where this image appeared. Now, you can limit by specialty, but as you can see, these are massive numbers. I mean, what is that? 12,000? 121,000 about cardiothoracic surgery. So it's very broad. So what I do when I want an image is instead of browsing way down here, I just say multimedia, and I might say lungs. And here are my images about lungs. Now, the thing you need to know about multimedia is it's not just images. It's also the category videos, okay? But it's not the category procedure videos, which we're going to look at in just a minute. So let's just get an image. We can click on the orange box that takes the videos out of our search results, and now we only have images. Let's look at this particular one. We can highlight it here to see it, or we can simply click. Oops, I didn't mean to click on the video. We can click on that image, and then we would be able to add that into a presentation if we wanted to. Sorry, I clicked too fast. Let me get back in here. So multimedia is not just images, okay? It's images and videos. What are videos? Videos can come from a variety of content in the product. This one came from Clinical Procedures in Emergency Medicine and Acute Care 7th edition. So y'all remember years ago when we would buy a book, a reference book, or maybe a textbook, it might come with a CD-ROM taped in the back of it. That's what this is now. These are those videos from reference books and any that may be in a journal article. So here we have a lovely video that we can watch. Now, what is the difference between a video and a procedure video? The content type procedure videos, again, can be found here. I'm just going to do ankle block as my example. These are procedures that are performed by medical professionals in a hospital. It doesn't mean that a nurse is going to perform these, but a nurse might be caring for someone who's going to have this procedure, or they may be caring for someone that had something, or they may be assisting with the procedure. So that's why it's nice to have those in this content and for nurses to know about them. They are also a video, but look at the rich text that comes with it. Your equipment with a picture of your equipment, the anatomy that relates to the procedure, and on and on and on and on. So the procedure videos are very in-depth, not only with that image and the multimedia to watch, but the text that goes with it. Whereas a regular video is usually just a short clip of a video, could be a lecture, could be something from a textbook. Now, that was a lot. It's 157. I encourage you to explore this product. Notice that your eye naturally stops about right here, but there's so much more. A little bit further down, librarians, you'll want to know about the new books and any updated clinical overviews. These trending topics, that's got the app sheet, little movie about ClinicalKey at the point of care, and then the resource center going to have promotional materials, directions for using the app and things like that. And I'll make sure that Jeremy gets those at the end. But that was an overview. How's everybody feeling?
Most confident, right,
Good.
everybody?
Yes, very good, very good. They're all nodding their heads, yes.
Excellent. Well, it's fun to me to
Thank
be
you.
with students. So that kind of perked my day up. An ode to my former career.
Hey, Sayla,
Uh-huh.
this is Donna, one of the librarians.
Mhm.
The pace and the engagement with which you presented this basket of joy. Thank you for recognizing. Thank you for being an information professional from higher education who recognizes pace and your audience and the way to deliver it in such a way that the audience got the best out of this. Um, we've I've known vendors who they're all about the sales, but they didn't know their audience and they rushed through it, or they use terminology that not everyone would understand. This was one of the best demos I've seen in a couple of years. So thank you for your time and your professionalism.
Well, thank you. That warms my heart. And librarians, if you ever just want a librarian focused one,
Yeah,
we need to get real and deep a little bit. We can do that next week too, if you
we're
want.
the ones to call. Absolutely. All right. Cheers.
Excellent. And I'll get this recording to you.
Okay, thank you so much, and I'll send the recording out to everybody, to the attendees. I believe I have the list of student names as well. Thank you all for coming, and thank you so much for walking us through this product. I know, it's one of our most popular tools. There's a ton of stuff in there, so it can be a little overwhelming at times. So we really do appreciate you taking the time to walk us through it.
You're welcome. Thank you all.
Thanks.
Bye.
Thank you.